This patient was referred to me a year and a half ago for endodontic retreatment of this tooth, tooth number 7. The root canal was done 5 years prior to that in a Western dental by a general dentist. And patient had symptoms, had pain. And you can see why. Look at that periapical relucency right there. So we went over options with the patient, and she decided that she wanted to try to save the tooth. So we went ahead and redid this root canal for her. Okay, so that was, as I said, patient came to see me a year and a half ago, so that was a year and a half ago. So take a look. So we went ahead, as I said, a year and a half ago and started the endodontic retreatment. This is my working length PA, X-ray, PA, okay. And here's the date. So I couldn't finish this root canal in one appointment. A lot of you ask me, what is my criteria for doing multiple visits, endodontic treatment or retreatment, if I can't get the canal dry but right before obturation. And in this case, I was going to fill with MTA, but I still couldn't obturate the canal. I couldn't dry the canal because it just pus, parallel discharge would just be oozing, and I couldn't dry the canal. So I placed calcium hydroxide and brought the patient back a week later. A week later, I opened the tooth up, removed the calcium hydroxide, and I see oozing again. So I washed the tooth, irrigate the tooth again, activate, and put more calcium hydroxide, and brought the patient back. And a week later, and this time I was able to get the canal dry and obturated with MTA. And here it is. So this is immediately after I placed my MTA, and I filled the whole canal with MTA here. And here's the date. Well, this is a few months later. Patient came back and said the tooth still hurts. We took an x-ray, and as you can see, the periapical relucence is larger. But as I said, I was thinking ahead already. I placed MTA in the whole canal, so I was prepared for apico. So we went ahead and did the apico. And this was today. This is 7 months after we did the apico. And look at that. All of that bone came back. All of that bone came back. 7 months post-op of tooth number 7 after we tried to redo the root canal non-surgically and didn't work and did the apico. 7 months post-op. Look at that. And if I zoom out, you can see what I'm talking about. This is 7 months ago, and this is today. Look at that large periapical relucency. That was a hole in her jawbone. All that bone grew back in 7 months. Take a look. Beautiful. Look at that result.